I've been in practice 22 years, excluding 12 years of postgraduate education after finishing medical school. So total would be 34 years. I'm a general internist because I did complete an internal medicine training program back in the late 80s. But also a general cardiologist and an interventional cardiologist. Interventional cardiology has been my passion since I finished my fellowship training when I was in Boston at the Sinai Hospital. And interventional cardiology is a subspecialty of cardiology that entails with managing patients with procedures, particularly managing patients with heart disease and with coronary artery disease by performing invasive procedure that can sort of overcome the need of open heart surgery. In terms of for new development and application of new procedures and new technology, we've been working very hard in developing a sort of what I call a personalized approach to medicine. There have been a tremendous advancement in both cardiovascular care, but also in technology. And that advancement have allowed us now to keep in touch and monitor patients from a remote location. So we've been working what I call a telemedicine program with the use of both implantable and wearable devices. The patient can collect the information, and this information then can be transmitted through a wireless system to a website, and we can have access to those information remotely. And it's going to help us in managing better patients, because in that way you can have an overview of the patient's status over a prolonged period of time, and you can intervene with changes in medication or by providing additional counseling. The excitement at Sinai right now is that there's been a lot of support for implementation of this technology, and I think this is the future of medicine. You know, the ability to keep in touch with patients remotely, and not only to monitor what we're doing, but also to monitor changes that can potentially lead to additional changes leading to adverse outcomes and hospital admission and sort of patient and major problem for the patient. It's very important to be an integrated health system, because within the health system you need to be able to have access to other subspecialty care, to technology, and also because eventually health system will be responsible for managing population health. So if you can have within the same organization all the different expertise and the appropriate infrastructure, it's going to be easier to manage population health.